Hello again, welcome everyone, and this is Jane, and this is Overseas Nursing Bands. How are you doing? Alright, I promised that I was going to do a video on the general marking criteria of any of the Osce, any part that you're doing, the general marking criteria that you should be aware of, things you should look out for. Anyway, this is Jane of Overseas Nursing Bands. Welcome back to my channel. Everything helping you with Osce for overseas nurses. We do all of those, helping you Osce tips, career progression in the UK, mentorship, coaching if you want. We do all of those, okay? But most importantly, everything is about you. So how are you? Okay, that's good to know. So today I'm just going to jump right into this video. Welcome my first timers. Well, thank you for coming in, and I hope you stay. Just subscribe, click and share, press the notification buttons, all of those things, so that each time I post a video you'll get a notification, and rush in here to see what to learn. Okay, so today I'm just going to talk about quickly marking criteria for this. Is pulled from the Osce marking criteria, all right, from their site. That's where I got this information from. So it says Osce marking criteria for all APIs. API, you know what that means. So what they be looking out for when you go to do any part of your Osce, what their examiner, your assessor, are looking out for. Number one, that you have assessed the safety of the scene and the privacy and the dignity of the patient. So when you come in the first time, you check, you make sure, oh, my scene, there's no wire, nothing to trip me, no hazard, no slipped water, nothing to make you fall. It's safe, you know, no naked wires, no carpets dripping, because examiners, they put all of those things as trick, okay? And you maintain the privacy of the patient. If there's a curtain, you cover the curtain. If you're touching the patient privacy, you maintain the dignity of the patient. All right, that's number one. They're looking at, have you done that? Obviously, that's the first thing you're doing when you come into the scene. So they are checking, have you done all of those things? Number two, you say you may clean your hands with alcohol rub or wash with soap and water and dries with paper towels following the World Health Organization. So when you come in, I have a video there where, you know, as you're coming in, you have to verbalize it. You know, wash my hands, you know, all of that, all of those, do all of those steps of WHO guidelines to show your examiner that that's what you're doing. So you have to show them and maintain that hand hygiene throughout your exam. Yeah, especially if you're in the station. Then you have to introduce yourself to the patient. You have to introduce yourself to the patient. Oh, hello, I am Jane and I'll be your nurse for today. How are you? What's your name? You know, you can do all this simultaneously. I'm not saying you have to do it in this order. You do it simultaneously. As you're coming in, you check. Oh, hi, welcome. My name is Jane. And then you're doing your hand, you know, like that. Obviously, you have to check for the identity with the patient. So what's important, the patient's name, you cross-check it with your sheets that you have with you, and either you check their date of birth if they're in the hospital, or their date of birth or hospital number, or both. Okay, and you verbally against the wristband where appropriate, and documentation. So you check, okay, you're checking, for example, you come to the patient. Sorry, I'm trying to get a sheet of paper. You come to the patient, this is your whatever you have, and then you are actually going, oh, your name is, you cross-check against their, oh, it's 2 3 4 5 6 7 8 9 10. You have to cross-check against the documentation that you have to make sure you have the right patient. They don't just tell you they are Jane and they were born in 17th of June 1999, and then you accept that. You have to cross-check with the documentation, the paper and the wristband they have with them. Okay, and then you have to verbally again check for allergies on the wrist and on the wristband where appropriate. If they have their allergy alerts bracelet on them. Oh, I can see you have XYZ. Are you allergic to anything? What are you allergic to? What happens if they say, oh, I'm allergic to penicillin. Oh, what happens when you take penicillin? XYZ happens. All right. And then as well, you have to gain consent and explain the reason. You can't just go and start working on the patient. You have to say, oh, today I've come to check XYZ. I've come to do this assessment on you and check your blood pressure just to make sure that you're all right. Are you happy for me to go carry on with that? And they say yes, and then you can go on. Pardon me. So you have to use a calm voice. Make sure your speech is clear, your language, your body language is open, and personal space is appropriate. I would advise you to go and read up on Stoller. STOLER is a method of communication. Is important. It will help you when you're doing, you know how to communicate. So it's STOLER. I might do a video on that, so you know how to be how to address, especially for some of us that's from different ethnicity and different things. In some part of Africa, looking somebody eyeballs to eyeball is insulting, while here in the West, avoiding somebody gaze means you're guilty of something. So you have to understand that, and yeah, we've all been through that. Okay. And the other thing you're doing, if you're doing your A and A to E assessments, you have to make sure the airways, no visual obstruction, breathing, respiratory rate. You have to check for respiratory rate, rhythm, depth, oxygen, saturation level, respiratory noises. The rattle is a wheeze, stridor or coughing, unequal air entry, visual signs of respiratory distress, use of accessory respiratory muscles, sweating, sinuses, seesawing, and seesawing breathing. No seesawing breathing where the chest comes out, and so this one comes out first before this one, so it's going like that. So when your breathing comes like that, right? That's what we're supposed to see, the movement of the chest. So seesawing is when this comes and this, so something like that, you know that something is wrong. So it's what you have to watch out. So when the person is breathing, the chest comes out first and the lower muscles come. So you're having that kind of, that's the seesaw breathing. I hope you don't have to go through all of those, because there's enough stress already. Anyway, you have to verbalize that. Another one is circulation. So you're checking for heart rate, you're checking for the rhythm, the strength, the blood pressure, the capillary refill, pallor, and perfusion. And then disability, conscious level, using ACVPU. So you're checking if they're alert, if they're confused, if they can voice, if there's pain, if they're unresponsive. And the presence of pain, the urinary output, the glucose, blood glucose, you're checking. In exposure, it takes and records temperature, that you are asking for the patient for the presence of bleeds, rashes, injury, and or bruises. You obtain a medical history, and you're accurately measure and document the patient vital signs as specific assessment tools. You calculate and record relevant scores accurately. So if you're using maybe, let's say, what is it called now? The GCS, if you're doing a GCS neurological assessment, or if you're doing a NEWS2 score, if you're doing a pain scoring, for example. But I think the important one is the NEWS2 score. Is it because that's where, like, what is this? That's the very important one. And then the GCS neurological assessment, make sure you calculate and score it very well. Very important. Accurately complete, document, signs, at dates and time on assessment chart. If you watch all of my videos, I say write your date, write your time, if it's appropriate, sign your initial. Before you start, if you're having a question that needs all of those and you're giving your answer sheet, I will write my name. I will write if there's need for a patient's name. If there's need for time, I will write the time. If there's need for my initials, I will put initials. You know, all of those things first before I start writing my answers. Why? Because you get carried away when you're writing, and then you're writing and then you forget. So once I would, if I get my answer sheet, what I would do is I will write my name, I will date, I will initial, I will sign where I need to sign, except when you're doing implementation medication. You have to first of all give the medication before you sign. Don't forget that. If the answer sheet you need, can write your name, initial and everything, but you have to sign the medication after you've given the patient the medication, they have swallowed it. That is the only exception to the rule. Otherwise, I would write my name and everything first. Just, you've written all those good things you've written, and then there's no date, there's no time, it invalidates, you scored 0. Sorry, you're rewriting it. And we don't want that. We don't want you to rewrite. It's expensive. And even not the money, the anxiety that comes with it, you know, so we don't want all of those. So if there's nothing you remember from this video, please do remember that. Thank you. And then you conduct a holistic assessment relevant to the patient's scenario. So whatever they are giving you, this person is a smoker, or this person fell down, you know, okay, you're doing on GCSE score, if you wanted to find out, are they diabetic, why did they fall, you know, what happened. It's very easy when you're doing your assessment. So once they give you your answer, from there, what they have said, sorry, not your answer, once they give you your question sheet, you know, your scenario, from what has been said, and then you pick questions there to ask the patient. So you're doing a holistic assessment for this patient. It's very important. Don't just please make sure that you do a holistic assessment of this patient. Are we together? Do you still love me? Well, you don't have to love me. I need you to pass. If you pass, I'm happy. And then you have to dispose of your equipment appropriately. So if you give an IM injection or something to do with needle, or you remove the catheter, or you have to say, you dispose this in the clinical bin, or this one in the normal bin, take away my instrument, wash it. If you did use things for vital signs, calibrate it and leave it for next use. It's very important you do that. Okay? And as well, clean hands with alcohol, or alcohol raw hand rub, or you wash with tap water, with soap and water, and dry with paper towels, following WHO guidelines. You have to verbalize this process. You have to tell them what you're doing. Yeah. So if I were you, while I'm practicing for my, as I'm normally, if you're anything you're doing, so that it becomes part of you. If you're in the toilet, you went to use the toilet, you know, start doing your business. Instead of washing hand as per usual, you go through all the process that you're doing. You go through all the process, you know, and as you're doing it, you're telling them what you're doing. And do it regularly before your exams. You get used to it. That's definite. You get used to it. All right. You act professionally throughout the procedure in accordance with NMC 2018, the Code of Professional Standard of Practice and Behavior for Nurses, Midwives, and Nursing Associates. So the NMC is the Lord and the King of nursing. They, you know, regulate it, so, and they have guidelines. And like I said, I might probably do a video on Stoller, S-T-O-L-E-R. I'll do a video on that. It's important how you talk to the patient, how you approach them, how you sit with them. They're very important. If you do all of this, it doesn't matter which scene that you're giving. Just apply as appropriate. I'm telling you, this is half mark passed already. The only thing is just to get the procedure you're being told. I mean, if you do all this thing, you've passed appropriately. If you do it, that's all you need to pass. Okay? Just follow what is on your, yeah. Anyway, this video is getting too long. Thank you for watching. Thank you for staying. I hope you enjoyed it, and I hope it's useful. I'm wishing you all the best in your forthcoming exams and you're preparing. Wish you all the best. Thank you for watching. Bye.